The potential that bisphosphonates or drugs that, modulate bone remodeling of having an impact on breast cancer recurrence has been discussed for many years. And some of the data were positive, some of the data have been negative. So this Clodronate study was actually a double-blind, placebo-controlled study addressing this issue of whether this tablet, Clodronate, could alter the recurrence rate of breast cancer. And the data were actually fascinating because when we looked at the overall group of patients, there appeared not to be a major change. But then when we looked at the subsets of patients and also where the recurrences of the tumors occurred, I think we have a signal here that this drug, Clodronate, may benefit some patients, specifically older patients, as well as the fact that this drug appeared to decrease the risk of breast cancer recurrence in other sites besides the bone. And intuitively we would have thought that a drug that affects bone remodeling would have the most impact in the bone risk of recurrence of the breast cancer. And it appeared to essentially decrease the risk of breast cancer recurrence in other sites besides bone. So what are we going to do with this information now? First of all, we have to take it and put it in the perspective of other studies conducted. And I think it's going to be really important that another trial is done, especially in postmenopausal women. There are several drugs available that can be tested. Clodronate is one, zoledronic acid is another one, and then there's a third drug that has a different mechanism of action, which is called denosumab. So I think we still have a little bit more work to do, but this study with Clodronate also supports further analysis of these bone modulating agents in the context of decreasing the risk of breast cancer recurrence.